Hi, I'm Dr. Simon Carlin. I'm here with Dr. Alex. Welcome, Dr. Alex.
Thank you. Thanks for having me.
Dr. Alex is volunteering her body to science today, and she's a recreational jogger, keen jogger. Last week we talked about movement and stability assessments and what we're going to look for in those movement and stability assessments, to how they relate to your movement and how they relate to your participation in your preferred sport. So it's springtime, everybody's outside, great, it's getting warm again, thankfully, and people are jogging. And what we're noticing is lots of people are jogging with all sorts of structural problems and problems in their muscle chains that are easily sorted out and kind of predispose you to developing bigger injuries and wear and tear. So what we thought we'd do today is just focus on a movement stability assessment with Dr. Alex. Now, I haven't checked her beforehand, so who knows what we'll find. And we'll just see how is she centered, what's her... So we're going to do a movement and stability assessment with Dr. Alex, and we're going to check her on her centering. That is she distorting one way or the other in an involuntary way? That is something that you're not in control of. What's her weight-bearing chain look like when she's moving? When she's on one leg, and if you're jogging, you will be on one leg. What's that chain look like all the way through your spine, pelvis, hips, knees, ankles, as we go through that process? And we're going to have a look at that, and then we'll check, see what her leg strengths are like, what the hip strengths are like, and also what the upper body and torso strengths are like, to see whether we're actually holding ourselves neutral, or are we kind of getting stuck and being pushed forward because our involuntary muscle system has been disturbed, or our head and neck have been injured in the past. All these sort of kind of really common things makes a big difference to how well you jog, how fast you go, how smooth your movement is, and how long you can jog for as well. Cool. So Alex, welcome. So we're going to just check you, and we'll just have a look, hold this up, and we're going to just check Alex's balance. She shows a bit of weakness on the right side, so pop your left foot forward. Very good. Let's just check that again. Back to neutral. She strengthens up. So we found that Alex, even though she looks like she's standing neutral, she was actually pulling into a pattern one way. It's not until we got her to stand forward that we actually got her back into neutral. So basically what that means is, over time, there are different elements in your spinal system that are under load, especially up here, and especially down your lower back. So your base of your neck, lower back are being rotated and usually pushed forward. And also her hips may be unstable. So let's just check the hips. So go, just relax there. Just bring yourself up onto one leg, so whichever one you like. And we're just checking to see how stable she is, and she has to work a bit at it, but she's pretty good. Let's go the other way, left side. And you notice straight away we had a bit of a sway there. Go back, relax now, just walk on the spot. Relax now. Go back up on your right leg. And we can see there's just a little bit of postural sway, so we know there's something happening in the pelvic system. That's great. So what we'll do then is we'll get you to jump up on the table here, Dr. Alex, and just go up, nose down. And we're going to check and see what her hamstring strength is like. One side is good, the other side on the right, not so good. If we check that again, that's nice and strong. This one isn't. And if we go up to her neck area, it strengthens up. So we've got something happening in her chain. It's actually starting at the top or the bottom, but the two ends need to be reset to get this hamstring back to being strong, because our left side is good. Now that just basically means we've got one knee that's kind of pretty stable and one knee where the hamstring is not strong, and so the knee is relatively unstable, and we'll have some tension building up around that knee. And Alex will tell you that this one feels a bit twitchier than the other side. Cool. If we check through her spine, we can go L5, definitely something there, it's moving forward, and we expect that because we found her in that twist, so we expect her to be moving forward. Now if you think about how many times that happens when you're jogging, that's significant. So I go through the rest of the spine, pretty good, and a bit forward up in this upper back area too. The whole spinal system is sitting forward there. Great. Thanks, Alex. Have a lie on your back. So we're going to just have a look and see, well, what about your hip strength? What does that look like? Try hold the leg up there, and the right leg isn't that good, and the left leg is pretty good. So go back over that again, we can see the right leg's unstable. So we know right hamstring, right hip, and also the right knee to some degree will be under load. So she's at risk of hip, knee, and potentially ankle trouble, because this whole chain, that's the structure of it, and the muscle chains are not operating as well as they could. Easily sorted out. We'll sort that out shortly, don't worry. But they're kind of part of the puzzle. Let's have a look at your trunk and torso tension and tone. Try hold that up if you can. Now she's pretty good there. Relax back. So let's just go hold your head downwards. Good, relax, and now come up. And now try hold your head up. And we get a little bit more weakness. So she's basically strong, but there's an underlying weakness that'll show up once she's been moving for a long period of time, or having a good long jog of 30 or 40 minutes. We'll start seeing this start to become more restricted. Good. Okay, so that's that. Let's just go out to these hips again and just see how much movement we've got. Okay, try hold that up there. Once again, right side and left side also a bit shaky. So we would suggest, therefore, that there's something going on the pelvis, because both hips, when we challenge them in a more profound way, show up weak, and most likely we're going to see something happening, and she's rotated on the left side of the pelvis. So that that completes our basic screen there. You can just bring that up to level, thank you. That completes our basic screen in our movement and stability assessment for a jogger. So we had a look at the key things that you're using. So are you centered? Have you got stability through your weight bearing chains, particularly lower back, pelvis, hips, knees? And also, when you're moving along, what's your trunk doing? Is it getting forced forward? Are you getting stuck in some way? Is there some imbalance there? And we found that there was, with Alex, only under load. So there's some things you can look for. Have a feel of your system when you're running around, because if you haven't had a movement and stability assessment in the recent short term, it's highly likely that you're carrying some of these faults, and they'll stop you enjoying your jog at the same level. Look forward to seeing you soon.